facility. We had 4 candidates that had applied for the administrative position and qualified, and so we conducted interviews with all 4 candidates. Candidate number 1 was Dr. Margot, Larry Margot was our first candidate that we interviewed. We have Mr. Lawrence Schindler and also Oak Island, and our 3rd candidate was Mr. Chuck Tanner, and then our last candidate was Mr. Ray Vega.
Making the final cut was Lawrence Schindler. During the Guam Memorial Hospital's board meeting Monday night, members voted to bring him to Guam to further discussion about taking over the administrative position permanently.
All in favor signify by saying aye.
Aye.
All opposed, same sign. Okay, we will bring Mr. Schindler out so we can meet him and he can meet us.
Schindler has a master's degree in healthcare management and a bachelor's in public accounting from Hofstra University, and is currently the director of operations and business development at the University of Nevada School of Medicine. In an interview with KUAM, he said he was excited about the possibility of making a difference here. Schindler adds all the issues the hospital is dealing with sound like a challenge, and it's very seldom that he walks away from one. One of the big items he'll have to tackle if hired is addressing concerns from the Centers for Medicaid and Medicare Services, which cited GMH for several deficiencies in patient confidentiality, life safety violations, and expired medicines and supplies. CMS granted GMH a deadline of December 30th to address their concerns. Schindler says he's dealt with issues like this in the past. His previous experience was working nearly 5 years at the New York State Department of Health Bureau of Audits and Investigations, where his work focused on Medicaid and Medicaid reimbursements, which allowed him to understand both from the government perspective and provider as well. Schindler will be participating in a teleconference this week with the board to continue discussions. Meanwhile, if hired, he would replace Ray Vega, who's been serving as acting administrator since the governor terminated the hospital's management team back in February.